The Stryker Berchtold Operon D830 surgical table offers 1,000 pounds of lift capacity throughout the entire range of motion and is the table of choice for a variety of different specialties. As you can see, this table does not have buckyboards or X-ray risers and offers a superior imaging window of 18.3 inches for excellent C-arm access. The D830 comes standard with a carbon fiber tabletop and offers 16.9 inches of longitudinal slide head to foot. This table slide permits up to 40 inches of upper body imaging and 44 inches of lower body imaging. Stryker's table comes with a detachable head section, back section, and leg section. You can take the head piece and attach it to the leg in order to create more room for procedures such as total knees or any other lower body cases. The D830 is able to stay charged for almost 2 weeks depending on the frequency of articulation, which eliminates hazardous cords at the head of the table for anesthesia. Stryker also offers Hydrogel 3-inch table pads that disperse the patient's weight in order to eliminate pressure ulcers for longer procedures when compared to standard table pads. Stryker's orthopedic shoulder chair attaches to the seat section spars and is integrated with the table as we offer a simple and efficient setup for shoulder surgeries. The unaffected arm comes with a rail-mounted arm board for complete customization to patient height. The affected side comes with an integrated lateral support for patient safety and a removable shoulder section allowing for maximum access to that affected side. After removing both the head and back section, slide the beach chair into the seat spars. Tighten both knobs so the chair sits flush into the spars. Once the beach chair is integrated into the table, ensure the headpiece is flattened and positioned for your patient in the locked position. Once the patient is intubated, hold down the chair button on the hand pendant. This will bring the patient into the beach chair position anatomically correct. You may also individually bring each section up or down by using the back, leg, and tread button. Once the patient is in the desired chair position, adjust the head section so the patient's airways are unobstructed and access to the affected side is optimized. Once the patient's head is positioned and locked, remove the shoulder section on the affected side. Perform this by pulling up on the lock and sliding the shoulder section out. Next, bring in the lateral support and slide into the holes at the back of the chair. There are 2 options for support height depending on patient height or breast tissue. Once you have reached your desired position, tighten both knobs. This should be snug to the patient's side. For the unaffected arm, we provide a ball-jointed arm board that is mounted to the rails. Put your clamp on the rail and slide the pull into the clamp's hole. Tighten the clamp to the correct height for the patient and place the unaffected arm onto the arm board. Once the patient is secured, you are ready to begin the case. Once the case is completed, remove the lateral support. Make sure the patient is centered on the table with the restraint strap on. Next, reattach the shoulder section to the chair and lock that section by moving the silver locks into position. Once the shoulder section is returned and the patient's arm is put into a sling, remove the ball-jointed arm board for the unaffected side. To bring the table back to the neutral position, press and hold the level button at the bottom of the hand pendant. This will bring the patient back to a supine position anatomically correct. Once the case has concluded and the table has been cleaned, loosen the knobs on both sides of the chair. Next, press in on the locks on both sides and pull the chair off of the spars. Begin to reassemble the table with first the larger back section connecting into the spars, and finally the head section into the back section. In conclusion, Stryker's D830 surgical table is designed to deliver on the increasing demands for flexibility while providing for an optimal range of applications with its improved mobility and modular design. Together with our customers, we are driven to make healthcare better.